Are you pregnant and you had a moment where you were like, did my water just break or did I pee my pants? Here's how you can tell. Alright, Hollywood has ruined quite a few things for you and me, one of them being pregnancy and all things labor and delivery, because as an obstetrical nurse, I'm here to tell you things are probably not going to go the way you've seen them go on TV or on the big screen. I mean, you're probably not going to be strolling through Central Park or on a beautiful horse and buggy ride and bam, your water's going to break, you're going to kick into labor, you're going to have your baby 30 minutes later, and you're going to look stunning while doing it all.
Way to go, Tater Tot.
I mean, your water could break and you could have that big dramatic gush.
My water broke! I'm having the baby.
Or your water could break behind baby's head, your baby's head could act like a plug, and you might have a slow leak, and then you're not going to know, did my water break or did my water not break?
That's my water, you idiot.
Even though amniotic fluid is just a boring old liquid, it actually has quite a few jobs that it does for you and for baby. We know it keeps baby protected and cushioned in there. It also keeps baby's umbilical cord from smushing down upon itself. It keeps you and baby safe from infection. It acts like a barrier, but it also helps baby's lungs to develop and it helps their digestive systems to develop. But we know that eventually baby has to come out of that sack of amniotic fluid to be born. They cannot live in there forever. But we don't know if your water has broken or if it hasn't broken, if it is that slow leak and not that big dramatic Hollywood gush. So here's how you can tell. If you're leaking, the first thing you're going to do, you're going to go pee. Empty your bladder so that we know it ain't pee if it's going to come out after this process. Then you're going to put on a panty liner and you're going to lay down in bed mostly flat. And you're going to lay there and relax for about 15 to 20 minutes. Now here's what you're going to do. You're going to stand up. And when you stand up, if you have a gush of fluid or that panty liner gets quite wet, it is probably your amniotic fluid because while you were laying flat, it was continuing to leak and it was pooling in that vaginal canal. And then when you stood up, out it came. And then if you're really not sure, you can pop your detective hat on and you can actually give it a little sniff. And that's totally okay because they're your body fluids, they're not my body fluids. So go ahead and get in there and give it a sniff. If it's amniotic fluid, it's not going to smell like pee. It's going to have its own scent. It's a little bit sweet, and that's another way that you can tell. But if you're still unsure after those couple of things, put a panty liner on again and come on into your birthing center or your hospital and we can check you out there further to tell you one way or another if your water has broken. If you go for the third option, what's going to happen when you get to the hospital? First thing we're going to do, we're going to ask you to empty your bladder. We are always asking you to pee on labor and delivery. And then once that's done, we're going to do a speculum exam where they insert a speculum in and they open it up so we can visualize your cervix. And we're looking for a couple of things here. First thing we're looking for is there any fluid that's pooling around the cervix? That could be a sign that your water is broken. And then we're going to take a special stick. It's called a nitrazine stick. And this says something on it that when it touches amniotic fluid, it actually turns black. So we're going to put that stick into the fluid and just rub it around the tissue surrounding the cervix to see if that color change is present, because that could be another sign that your water is broken. And then we're going to take that stick and we're going to rub it on a glass slide, because this is the most definitive way to say for sure if your water is broken, because amniotic fluid, when it dries on that slide, it leaves a beautiful design. It looks like ferning when your provider looks at it under a microscope. So those are kind of the ways we can determine if your water is in fact broken. And it is important to find out because we mentioned before that amniotic fluid and the amniotic sac, they work as a barrier to help prevent you and baby from getting an infection. And then once it is broken, that is a portal of access for bacteria and it opens you up to the chance of an infection. So if your water is broken, chances are your provider is going to want to help get your baby delivered by around 24 hours after your water broke, because after 24 hours, your chance of infection, it is going to increase.
You've got 24 hours.
Okay, here's what I think is really cool about amniotic fluid. It might come out different colors than you were expecting, though some of these different colors could be normal, and some of these different colors might be concerning. The most common color you're going to see is this clear color, or like a slightish yellowish tinge. It might have white flakes in it, it might have some skin cells in it, it might have fine baby hairs in it, because your baby's been floating around in this fluid for like 40 weeks now. It's going to have that sort of sweetish smell. It should not be foul smelling. Now you might also notice when your water breaks that at first it's like a pinkish tinge and then it turns clear. This is still going to be a normal sign, because that pinkish tinge in the beginning, it's probably coming from something that we call bloody show. And this presents itself by fine tears in the cervix that happen as your cervix is changing. It's dilating and it's thinning. So it's actually a really good sign. And the reason it's normal is that that first pinkish color is caused by that bloody show, but the fluid itself coming behind it, it's actually clear, which we know is a normal finding in pregnancy. Now, if your water breaks and you're at home and it is bright red in color, I'm talking like first day of your period, bright red, I want to be super clear here. This needs to be investigated by your provider right away. Any bright red bleeding in pregnancy should be looked into, but a bright red color in the fluid, it's probably indicative of an issue with your placenta. And we know that your placenta, that is your lifeline for your baby. So this color in amniotic fluid needs to be taken seriously, and it needs to be checked out as soon as you can. And the last color you might see is this green or this greenish brown. Now, no matter how thin or how thick it is, it's telling us baby had a poop while they're in your belly still. Now, usually babies wait till they're earthside to have this beauty, but sometimes they can't help themselves and they let it go while they're in there. So anytime we see this green fluid, we call it meconium stained fluid, because that first poop by baby, that beauty, is known as meconium. If you know, you know. Now, some people say babies will do this if they are stressed out in utero, but we see it really commonly in babies that are very close to their due date or beyond their due date, because they just can't hold it in there anymore. Now, I said it can be thin or it can be thick. If it is thin, it's going to be this kind of lightish, greenish, yellowish color, and it might have a foul odor to it, but it could also be thick meconium fluid. Now, thick meconium, it sort of have a consistency of pea soup, and it is very likely going to be foul smelling because this, let's be honest, they are swimming around in soupy poop. And thick meconium fluid has a higher likelihood of baby having low APGAR scores, of them needing some resuscitation at birth or needing help with their breathing, or sadly, it's going to have a higher risk of you needing an emergency C-section to have your baby. Now, I want you to know, if your baby does have meconium fluid, the birthday party that you are a part of is going to get bigger, because your baby is going to have a special team just for them present at the birth in case they need any of that extra help when they are transitioning to life earthside. This team is probably going to consist of a specialized nurse, a respiratory therapist, and a specialized baby doctor known as a neonatal intensivist. Now, if your baby comes out and they are crying and they are screaming and they are pink and they are happy and all toned up, then chances are it's going to carry on and you are going to be skin to skin, and we are just going to monitor baby for any signs of distress. We're not going to do any big interventions. But if your baby comes out, and again, this is more common with that thick meconium, and baby is pretty flat and they are quiet and they have not taken those big breaths and given us those big cries, then chances are your provider is going to hand them off to that team at a warmer in your room, and they are going to give baby some help to get that breathing started, but to also remove some of that meconium from the airways before they breathe it into their lungs, because that's how they can run into trouble. So you might see baby getting some suctioning or some breathing support, and they might have the heaters on to help baby with their temperature control. And we are, of course, going to watch that baby even closer for any issues with their breathing. All right, we know your water has to break at some point in time so your baby can be born, but how's it going to happen? Well, if you break your water on your own, that's called a spontaneous rupture of membranes. But there is another option here, and it is that your provider could break your water for you. You're thinking to yourself, Tina, why would I want somebody else to break my water for me? There's actually a couple of reasons. One is that if you need a medical induction of labor, this could be a nice option to get labor going for you. But if you are in labor and we are looking to speed up your labor for whatever reason, breaking your water can do that as well, for two reasons. One is that your amniotic fluid actually contains something called prostaglandin, and prostaglandin is a substance that works on the cervix to make it nice and soft and ready to do more dilating and more effacing. And then the other way is that when we break your water, we take away that cushion of fluid that's sitting on the cervix, and instead of that cushion, you now have a hard baby's head. And a hard baby's head with contractions on a cervix that is soft and ready is going to make it dilate and efface that much quicker. But to break your water, a couple of things have to happen. One is that you have to be dilated, because it is done by a cervical exam, and then the provider uses their fingers to guide something called an amnio hook, which looks kind of like an overgrown crochet hook, and they use that hook on the sac and they break it, and that's how your water breaks. But also, baby's head has to be down low enough in the pelvis that this is a safe medical procedure, because if baby's head is sky high, it is way up in your pelvis, and your provider breaks your water, there is a risk that the umbilical cord can actually float down through the cervix in front of baby's head, and then with a contraction, baby's head's going to come down on top of that umbilical cord. It's called an umbilical cord prolapse. This is an obstetrical emergency, because that umbilical cord, that's baby's lifeline, right? And when you put baby's head on it, it sort of works like when you kink off a garden hose. It stops that flow from going through it, and you would then need an emergency C-section right now. It is very serious. That is a risk of the procedure, and that's why they check baby's placement. Now, we know that baby being engaged in the pelvis, it's important for that procedure, but it's also important important for labor and to keep your labor progressing. And if you want to learn more about how you can get your baby to be engaged before all of this stuff is happening, why don't you go ahead and hop over here and check out this video, because it's going to tell you all about it and the ways you can get there. Bye.